Ladies and gentlemen, please welcome our first speaker, Dr. Camilo Roa, Jr.
TB has an interesting life cycle. When one gets it, it sleeps for a long time in most cases. Only 5 to 10% will show it. Many of them early, but some of them later. So if they're not sick, they're not detected. Okay, those detected because they are sick, you treat them, they get well. But what about those who are not feeling ill, they are normal looking, and they are the source of future infection. As long as infection is in the bodies of Filipinos, it will take a long time for us to eradicate this condition.
Ladies and gentlemen, it is an honor to introduce Dr. Masae Kawamura.
I'm very honored to be presenting today to all of you in the Philippines. I'm very humbled by this honor as well. It has been my life goal to eliminate TB wherever I am. And certainly, most of our TB in San Francisco came from Asia, a large proportion from the Philippines. And I'm still a doctor at the TB clinic, part-time. Of course, I have a full-time job now, so I see patients now maybe once a month, once every 6 weeks. And many of my patients were Filipino. And so I can tell you right now that at least a third of you, if we did the skin test, would be positive. And I'm sure all of you are feeling well right now. How many of you have actually had a skin test in the past? And some of you have. And I'm sure some of you are positive, but we're not going to break confidentiality. Because having TB, even though no one's at fault, carries a lot of stigma. And especially among Filipinos. And it shouldn't because it's such a common infection, but it does. And the reason why I have this lifelong passion for TB is because TB is preventable and it's curable. Now, we only talk about the curing the active TB part, but we don't talk about the prevention part. And we in public health are not doing our job unless we actually prevent before they develop disease. And so this is what we're really focusing on today as a strategy, and this is what we've done in the United States and have been very successful at. So I'm going to talk about new concepts for Asia in accelerating the decline by prioritizing TB screening and prevention. Tuberculosis has already been described to you, but it's one of the most enigmatic diseases for mankind. It's been around for thousands of years. And the reason why is that it's a slow-growing organism. It has a thick, waxy coat. It's very difficult for the body to kill it. And it easily evades our immune system. And it can persist in our bodies for years to decades. You can carry TB for decades, maybe infected as a child, but as an elderly person who develops end-stage kidney disease, you may break down with disease 50 years later. So where are we actually in TB control? Okay, you heard Dr. Roa talk about the DOT strategy. And what researchers have actually concluded, Lana recently in an article in the International Union Journal, is that DOTS is not sufficient. Actually, the WHO is recognizing this. And that passive detection, which is the strategy, okay, passive and only of the smear positive patients, as Dr. Roa mentioned, TB is already spread to others. And these people are quite sick, they have a lot of damage to their lungs. And there's decreasing mortality, but the rates are actually stagnant. The actual burden, the numbers, and the incidence. The other thing is that right now, we are only detecting the full-blown cases down here. But there is a large reservoir of latent TB infection and early cases that are not yet symptomatic. Okay, we're not diagnosing them. But there are lots of new problems that will change TB and this reservoir, and it may overflow and really become epidemic. Okay? One is diabetes. The diabetes rate in Philippines and in Asia is growing tremendously. and it's probably anywhere between 10 and 15%. Aging is another one. As you get older, your immune system gets weaker and it's harder to contain those organisms and you break down. Immigration, now this is less of a problem for the Philippines, but you do have a lot of people coming in from other parts of Asia that have high rates of TB. Although I would say that the Philippines exports more TB probably than imports at this point. But TB is a disease of poverty and migration. And guess what's happening in Asia big time? Urbanization. And we'll actually go over some numbers there. So people are moving from the rural countryside to the big cities like Manila. And again, living in crowded living spaces and really probably not being as healthy and developing TB. And of course, more easy to spread.
How much and how long would it take the treatment for latent TB infection? And if it's covered by PhilHealth insurance program of the government? Thank you.
As far as the actual estimates on latent TB infection, I was extrapolating from the global and from my experience in San Francisco. For adult Filipinos in San Francisco, infection rates using the skin test were about 50%. Using an INQUIRER, it's less. Much less, so it's maybe by 40% less. So probably around, I would say, 25% using an INQUIRER. Just general screening population. However, that's in San Francisco. Filipinos in San Francisco, which may be a different population, right? Maybe you would say the immigrants that are coming in are healthier, richer, etc. So that's kind of a modern estimate. How long is the treatment for latent TB infection? If you use the standard treatment, which is isoniazid, which is one of the TB drugs, it's 6 to 9 months, and INH costs pennies a day.
Talking about prevention, Dr. Kawamura, if the immune system of a patient is strong, is he still susceptible of having latent TBI? And are we saying that we should also address the malnutrition, especially in developing countries, so that we will not have these problems?
That's a very important point. However, because we all breathe, we're all susceptible. Every one of us in this room. TB is an equal opportunity disease. Okay, we can all get infected, but if we're healthy, we are less likely to break down with disease later on. We're much more likely to contain our infection and maintain control of that infection. So the person who is malnourished probably has a weaker immune system. And so actually malnutrition is a big issue, especially among children. And so just dealing with malnutrition will help TB control.
You mentioned earlier that prevention would largely depend on the private sector. But since in the Philippines, the prevalence and incidence of TB is growing fast, would you recommend legislative support as well, since to fast track the eradication to meet the WHO goals?
If I ruled the world, absolutely. It really will be the willingness of the Filipino government to tackle this problem. I don't believe that even the current program is adequately funded to do all that it needs to do for active TB. And the reason why I point to the private sector for screening and prevention is they're the ones who have access to the populations that need to be targeted. Of course, guidance is needed into who they should be targeting, like we have in the United States, and perhaps even some legislation to screen certain groups of people. For example, in California, based on the old epidemiology, all school teachers had to be screened for tuberculosis so that TB didn't enter the school system, and also food handlers, because they're working together, etc. So those are just examples. So government involvement is really critical, and partnership is really critical And if they had TB clinics that could do both active and latent TB treatment, I think that would be very helpful because the expertise will be maintained within the TB control programs as well. But again, this is a big issue of resources and resourcing up, and what is the value to society? That's the big question. Of course, I think it's really important, but it's up to you all to find it important.
Thank you very much.
I know this talk is about prioritizing TB screening, but given the high prevalence and incidence rates in the Philippines, does just being Filipino, should the average Filipino have himself or herself screened for latent infection?
That's a very good question. And in the United States, there are foreign-born guidelines that are being reviewed by CDC. It's been stuck there for a long time. But the experts in that foreign-born guidelines committee concluded that all foreign-born from high-incidence countries should know their TB status. Personally, I think that it's an important thing to know, because even though you may not get treated because you're healthy now and there are no indications for LTBI treatment, when you are older and you develop diabetes, that would be a point where you want to get reevaluated for TB and also get TB treatment, right? So I think it's a very important part of just standard medical care and knowing your status, but this is a personal opinion. Again, you have to prioritize and strategize, but I think in a perfect world, you know, in high incidence countries, and certainly in countries of low incidence, we are encouraging that the status be known for the individual's benefit and for their health long term. Overpopulation is a huge public health problem and results in TB. Okay, so to control the overpopulation, contraceptives is one of the strategies. And so I wouldn't trade one for the other. I think all measures are important. This contraception is really a long-term strategy. And the treatment of latent TB is one for now and for the future as well.